welcome back to Podcast with Pharmily as we delve into journeys of remarkable individuals shaping the field of pharmacy. I am Ainatis, Vice President 2 of Sophie's 2024. I'll be your new host for Podcast with Pharmily. So, in this second episode, we are thrilled to bring you an engaging and inspiring conversation with our special guest today, Dr. Muhammad Faiz Othman, who is a senior lecturer under the Department of Clinical and Pharmacy Practice in Faculty of Pharmacy, UITM. So, Dr. Faiz is a leading expert in the field of radiopharmacy, which is a specialized area in the modern healthcare that uses radioactive substances in the use of diagnosis and therapy. So, let us all enjoy as we discuss the topic for today, radiopharmacy, seeing the unseen. So, before we start with our topic for today, maybe we can have a little bit of introduction from Doctor that you want to tell our listeners out there.
Okay, thank you. First of all, thank you for inviting me to this podcast. A little bit of introduction. So I graduated from BPharm in 2007 from this university. At that time, UITM was still at Shah Alam. The faculty was still at Shah Alam. So, yeah, and then subsequent to completing my BPharm, I did the PRP-ship at Putrajaya Hospital for 1 year, and then pursuing my master's degree in radiopharmacy and PET radiochemistry at King's College London, and then returned back to serve with UITM, and then continue back for my PhD study, and now here I am, serving for the country. Serving for the university.
All right. Yeah. Okay, thank you, Doctor. So now we get into the first question. So, Doctor, can you explain what is radiopharmacy and why is it actually important in healthcare?
Okay, radiopharmacy, it's a specialty of nuclear medicine. So it means that we are using radioactive either for treatment or diagnostic purpose, which is for medical purposes. So, basically, the radiopharmacy fields is the activity that involve the preparations of radiopharmaceuticals drugs. Yeah, and that involves pharmacies. Yeah, so that's pretty much it.
So next question is, I believe that you were once a nuclear pharmacist back then in 2022. Okay. So what actually made you wanted to pursue in that career?
Okay, so nuclear pharmacy has always been my, I set target for myself since the beginning of my BPharm study. I would like to pursue into this specialty, partly because I have interest in nuclear science. Mm-hmm. Pharmacy is where I think after negotiations with my parents, I did my master's degree in pharmacy. So I think looking at one of the subjects is nuclear pharmacy make me, I think, keen on continuing this field. So it is because the arts in the radiopharmacy, I think the nuclear science that makes it interesting. At that time, the use of radioactive for health reasons, for health purposes, though it is already advanced in the international scenes, but within the country is pretty much, I think we are at the basics level services. Yeah, so what makes more interesting is that I always think that pharmacy in our country at that time in 2007, in mid 2000, something like that, I think we are at the level where we can expand more rather than satisfy with basic degree or basic services of a pharmacy profession. So that's why I think what we need to do is to get this area advanced, to be involved with this. So yeah, after almost 15 years in this field, I can say that there's a lot of things going on, and future look more interesting for everybody in this field. Yeah.
So it was actually based solely on your passion, and you wanted to bring Malaysia healthcare forward with these modern, I would say, modern healthcare.
Yes, this modern approach. If you look at the topic, seeing the unseen, the one of the was suggested theme for this. it allows us basically to look at what happens in the body, whether it's anatomical or dynamic. So it allows us, radioactive allow us to assess these conditions. We cannot see this, I mean, in terms of, let's say, the heart movement and everything, because of the complication if you are cut patient open. But these radioactive preparations, nuclear medicine, allow us to see this. So we cannot see things, but we have tools to let us seeing things, which is interesting. So yes, I believe we are in the right path, and it is going to be interesting.
As you know, the number of radiopharmacists in Malaysia is relatively low. So do you think that there are any gaps in the education which leads to the low number of radiopharmacists in Malaysia? And if you think they have any gaps, what can we do to address this issue?
It's a good question. Pharmacy students in general, I think in our country, they like to be in the clinical pharmacy. I think that's the first choice for any students. If you do some kind of polling as well, you can see that students are more attracted to clinical pharmacy. So all these subspecialties like nuclear pharmacy is, I think, it is quite hard actually in terms of the science, but it's not that hard, to be honest, once you are in there. So I think it could be the reason that hinders the student. I mean, people don't want to think too much on, on complicated things. But I think it could be one of the hindrance. Yeah, maybe lack of awareness as well as exposure to this field. In this country as well, we can see that in terms of academics that is active in this area, I think I can say that very few. Me and could be another person. So maybe 2 or 3 at most radio pharmacists around. So obviously with these numbers, the output will be much lower, and students are not really interested, not just in this university, but I think throughout the country. So this is what is happening now. But I'm proud to say that after how many years that I serve UITM, I can meet now several of UITM pharmacy alumni in this field. So which is a good start, and I hope that I can contribute to the numbers in the future. Yeah.
All right, hopefully. And even in my batch, I would say that since we have elective subject radiopharmacy now, I feel like there are not a lot of students who would choose radiopharmacy as their first elective choice. But as the students have now gotten into the radiopharmacy class, they said that it's actually more interesting than what people would actually expect. So I think that's a good start, actually.
Yeah, good to hear that. Because I think maybe the name itself hinders people from getting, involved, know more about radiopharmacy. What we tried to do last time as well was that we tried to put one class of radiopharmacy in hospital pharmacy, which is I think in 3rd year. So hoping that it will gauge student attention towards this subspecialty. We're seeing the fruits now, whereby I think this year we have the most number of students registered to the course. Could be some other factors as well, but in terms of number per se, we have most numbers of students interested in this course. It's a good start, but I hope that we can fill in the gaps and the needs of radiopharmacy around in the country, because this field is a growing field.
Yeah.
Where I think in part of the pharmacy field throughout the country is quite saturated already. So for those students, for the students that are interested, I think there might be some kind of gap that you want to fill in. Try to find in when you're looking for jobs. Yeah.
All right, so one of your research projects is about audio electron emission, and I did some reading about TRT, which is targeted radionuclide therapy, and which is one of the technologies that leverages the principle of audio electron emission. So, in your opinion, do you think that this TRT is better than chemotherapy, or do you have any other opinions regarding this TRT? And
It's so much better if you knew. You cannot compare chemotherapy. The technology of chemotherapy comes back in the 1950s, 1940s, when people started with sarin gas. From there on, a lot of chemotherapy is coming on, but those information or technology are still being used till today. It's a shame to say that those drugs are now after 70 years, 80 years are still in use, become the mainstream. Among the downside of chemotherapy was that the non-specificity of the treatment. It targets at all cells. Cell phase. So what makes it non-specific. I mean, it kills all the rapidly dividing cells. With current technology, where we have with targeted therapy, you have specific antibody or specific peptide targeting specific cells. You can either tag it with radioactive materials that used for diagnostic, which is maybe emits gamma ray, or for therapeutic purposes, you can tag with radioactive that emits alpha or beta radiation. So with this, you can diagnose the patients accurately, and then you can treat the patient with the same agent, same peptide, accurately as well, very specific, without affecting any healthy living cells. And then you can re-image, assess the status of post-therapy or treatment status following therapeutic bombardment. You can go with another diagnostic tools. Diagnostic imaging, looking at the treatment response, which is very specific. But with chemotherapy, what we have was they just have, like, say, doing CT or MRI, looking at the tumor anatomical, and then treat the patient, and then redo the imaging again, which is non-specific to that disease. So these alone, I think, make up a very good, combinations in cancer therapy these days, which I think it fits now that we live in 2024, that we should go for this more high accuracy targeted therapy without harming the other healthy cells. I hope I didn't bore you with all those information. So yeah.
All right, we can see that the advancement of the modern healthcare is that this technology is more specific than the chemotherapy.
Yes.
But why is it not widely yet used in Malaysia compared to chemotherapy? I mean, it's not as famous as chemotherapy, but it brings much better outcome for the healthcare.
It's a good question, but I think all these things comes with cost. So chemotherapy, being it's old drugs, the cost is much less. So to be widely used in general population, it is costly, especially now the system that we are adopting, where government funds most of the treatment. Is very costly for the government. I think all of us have to understand that. We can see now that the government also incorporate all these treatments in some cases. Means that the introduction of this highly targeted therapy are being adopted in hospitals. Maybe not widely yet, but it is moving towards that. But yeah, it will be surely it will be incorporated once we have more evidence. Then we can see that it will be in the service years to come. But I think partly because of the cost, when we think that why it is not in the service yet.
So, do you have any of your current research projects that you would want to share about radiopharmacy?
Okay, currently I have basically 3 projects. I think that is actively going on. One of it is the preparation of one-step kit with technetium. We try to prepare radio-label antibiotics. When we put technetium into it, we can inject to the patient straight away. So this is one of the activity that we're currently doing. So in case where patient has been feverish for a long period of time, unresponsive to antibiotics treatment, So this radio label antibiotics hopefully will allow doctors to assess whereabout the infections in the body. So that's the idea of this. Secondly, the project is on the bisphosphonates, radio label bisphosphonates, namely palmidronic acid or palmidronate. We radio label it to gallium 68 or fluorine 18. These two are interchangeable. We prepare two kinds of preparations. With the idea is that these bisphosphonates or palmidronic acid, it will be detected, taken up by the bone cancer actively dividing cells in the bone. Recently, we found out that after much interrogation and brainstorming, we found out that it could be useful in understanding calcium deposits in the vascular. So with this, hopefully we can make use of the this palmidronate, radio label palmidronate for imaging calcium deposition of blocks, blocks due to calcium deposits. And finally, I think the project is on the radio label fibroblast activating protein inhibitor, or another name is FAPI, a short name. It's shown to be able to detect 28 type of cancers, but our project is just looking at the radio labeling and QC validation study. We are trying to look at the how we can prepare that for the hospital users. So the advantage of this was that it's shown to be able to detect up to 28 types of cancers, which is a lot basically. So in very high sensitivity and specificity. So hopefully, it's almost done, and then I think that's pretty much about the current project.
So currently you have 3 projects, which is actually very fascinating to me, and it's amazing how you put a lot of effort and work into these recent projects.
Thank you.
And I hope that your recent projects can actually bring a much better healthcare system in Malaysia. Do you have anything to share about the latest advancements in radiopharmacy and what can actually it impact the patient care?
Okay. So when we talk about advancement, a lot of things that are going on left and right. First thing first, radiomics is coming in, where the incorporation of artificial intelligence into the imaging studies, whereby machine learning from the images and data that has been generated are now translated into one-step diagnostic tools. Means that next time when we have imaging, so this AI can straight away diagnose. So that is coming up. Another thing is that new traces or new antibody are being being identified, whether it's good or not for the imaging for whatever kind of disease. Which is interesting as well. And lately we can find another new radionuclides are being introduced in the clinics, like actinium 211, currently being used, being suggested for bone cancer, palliative treatment for bone cancer. Terbium 161, another OJ emitter that is touted to be one of the to have therapeutic properties in cancer treatment. So these are some of the advancements I think that currently happening worldwide. But in our country as well, we can see that the investment are being made into this area. Me myself, I think I've heard that now currently we have 2 cyclotrons. Cyclotrons is a tools to prepare to produce radioactive material. So currently we have 2 in the country, but I heard there are 3 more being set up in I think within this years. So it allow us to produce a lot more radioactive, produce more. Making life more interesting actually in this field. Yes.
You can see that radiopharmacy is definitely moving forward in Malaysia. So, Guys, before we end our session of podcast today, maybe we can have Dr. Faiz to share anything you want to share before we end this session about the future of radiopharmacies in Malaysia.
So I would like to urge actually students for those who I think have interest in radiopharmacy, or maybe you like chemistry, physics a little bit, maths a little bit here and there, and biology.
Quite rare.
So, yes, it's a mixture of these all sciences disciplines. So why not you try yourself in this area? Hopefully it can benefit you in the future.
So that concludes our episode with Dr. Faiz. We hope you found his insights and journey as fascinating as we did. So upon concluding the series, we extend our heartfelt thanks to Dr. Faiz Othman for sharing his deep knowledge and personal insights into the field of pharmacy. So Dr. Faiz's expertise and passion have definitely given us a clear understanding of the critical role of radiopharmacies in Malaysia. We also want to thank our listeners out there for tuning in. Your support and interest are what makes this podcast possible. Be sure to follow us on Instagram and TikTok of Sophies UiTM and subscribe to Faculty Pharmacy UiTM and Multimedia Sophies UiTM for more inspiring conversations. Until next time, Podcast with Pharmily, where conversations spark beyond pharmacy world. Bye!